Before we get started, let's discuss a couple of terms. Coinsurance. This is the amount the patient may be required to pay as their share of the cost for services after they pay any deductibles. Coinsurance is usually a percentage, for example, 20%. Deductible. This is the amount the patient must pay for health care or prescriptions before Medicare, their prescription drug plan, or their other insurance begins to pay. Medicare-approved amount. In original Medicare, this is the amount a supplier accepts assignment can be paid. It may be less than the actual amount a supplier charges. Medicare pays part of this amount and the patient is responsible for the difference, or the coinsurance. Medicare Part B covers home blood sugar glucose monitors under their DME and supplies used with that equipment, including test strips, lancet devices, and lancets. The patient's responsibility is 20% of the Medicare-approved amount after the yearly Part B deductible. There are limits on how much or how often a patient can get these supplies. There are two types of diabetics, insulin and non-insulin dependent. Medicare's basic utilization guidelines are: if a patient uses insulin, they may be able to get up to 300 test strips and 300 lancets every 3 months. This supports them testing themselves 3 times a day. If a patient does not use insulin, they may be able to get up to 100 test strips and 100 lancets every 3 months. This supports testing once a day. Suppliers are not allowed to dispense supplies exceeding the patient's expected utilization.